I was walking through the Crown and Bridge department the other day and I noticed a case sitting on one of our technical advisors' desks, and it's an interesting one because it's something that we see a little more often than you think we should. And basically what's happened here is that the syringe material that was used around the prep did not set up. And this other material, they're both polyvinyl siloxanes, the rest of the material did set up, and so it makes you wonder what happened. We flip it over here, and again, you can see kind of a weird look to that impression. This one looks like it was almost set up as the patient kind of bit into it. It's got this kind of glossy, kind of strange look. Actually, looking at it a little bit closer, it looks that way because that's a partial denture. Everything else here looks okay except for the syringe material, and when we take a look at a couple of the pores of the impression, you can see that that syringe material just literally came off in the stone when this was poured up, and it was poured up again for, that's the solid model, and it was poured up for the pinned model. And again, you can see that orange kind of syringe material that's actually adhered to the stone, because when the dye stone was poured into the impression, that inner syringe material wasn't quite cured. And so obviously we are lacking a lot of detail when this is poured up because of the fact that that inner syringe material was not solid, and therefore we can't get a good pour from it. So the doctor's going to have to re-impress this. And as we look at it and try to figure out what happened, it's like, well, this was set beforehand, because this appears to have set fine. In fact, even when you come in here and push around on anything here on the yellow material, it's fine. It's really just that orange material where something went wrong. So perhaps it was a two-step impression where the yellow part was taken first with the tray in the mouth, and then the tooth was prepped and then relined with the orange material. So when we start to think about causes of contamination for polyvinyl siloxane materials, we know that the sulfur in latex gloves, and for that matter rubber dams, can inhibit the setting reaction of the polyvinyl. So maybe the yellow did not get in contact with gloves, and maybe the inner material did for some reason, although that's a little hard to figure out. I guess if the doctor touched the prepared teeth with gloves on, we could have had that happening. If that does happen, and you are touching the tooth for some reason, you can just use some hydrogen peroxide to clean that off, to get that sulfur off the preparations and not contaminate the impression. It'll happen sometimes, allegedly, from taking a retraction cord. If your assistant takes retraction cord with latex gloves on and then cuts it, supposedly you can actually transfer that to the gingiva, the one place where it's really important to get this syringe material and have it set well. So if you take a piece of retraction cord and hold it with gloved fingers and then pack it around the tooth, allegedly you can contaminate the polyvinyl. That being said, every tooth that I've prepped and packed cord on in the last, 10 years, I've held with latex gloved fingers and flossed it into place between the teeth and then packed it into place. And I've never personally had this happen. I've never actually seen this happen on one of my impressions. And so one of the things you'll read is that some of the astringent materials that we use can actually contaminate and inhibit the setting reaction of polyvinyl siloxanes. And I use the Viscostat and Viscostat Plus, Viscostat Clear from Ultranet, and I've never seen this type of thing happen, even though I use it around probably about half of the preps that I do. One of the other things I've seen in the literature is that exposure to residues from temporary materials such as bisacryls can actually inhibit the set of some of these polyvinyl siloxane materials. So if you take an impression like some dentists do and then use that impression to make the temporary and then reline it with light body material to take an impression of the prep, that could affect it too. And so you're going to want to make the temporary after you've taken the final crown and bridge impression. I know some dentists who use a separate impression, but they make the temporary from the prep before they take the final impression, so they can be trimming it while the impression's in the patient's mouth setting. And there's definitely some things that indicate that those type of bisacryl materials can leave something behind that will inhibit the set of these polyvinyl siloxanes. And the last thing that I've seen the finger pointed out as a culprit in cases like this is exposure to air-inhibited methacrylate. So for example, in composites and adhesives, that air-inhibited layer that we have on the surface, if that is allowed to come in contact with these, there are reports that it'll keep a polyvinyl impression material from setting correctly, as we see here. So if you're doing a buildup and it doesn't get prepped, or you put some bonding agent on to form a hybrid layer, you're always going to want to take like a 2x2 or a little cotton pellet with some alcohol soaked on it and rub it on the tooth to get rid of that air-inhibited layer, so that we don't have something else that could possibly retard the set of this impression material. So again, this isn't something that happens a lot. We might see 2 or 3 like this per day, and that's out of thousands of impressions coming in. But it happens regularly enough, and it's really kind of tough to figure out exactly what's happening, especially if it only happens to you 1 out of every 100 or 200 times or something like that. So I wanted to list a few of the causes, a few of the known or alleged causes which might cause this. So hopefully you won't have this situation happen in your own office and won't need to call the patient back for a new impression.